Lower jaw otherwise called mandible. Mandible. It is a horseshoe shape or V-shaped bone. Okay. Unlike maxilla, where it is a paired bone. Paired bone means like you can see maxilla, one right maxilla and left maxilla, both together called two of them called maxillae. Okay. Unlike maxillae, mandible is only one bone, single bone. Okay. It's a V-shaped bone or horseshoe shaped bone. Parts of a mandible. If you see one side, to see the parts of the mandible, you can see the body of the mandible. The body of the mandible. And the body of the mandible turns abruptly upright. Okay, where it is turning is called the angle of the mandible. Angle, A-N-G-L-A. Angle of the mandible. And the one it's moving upright, it's like that, changing its direction, is called ramus, R-A-M-E-S, ramus of the mandible. Is that clear? Yes? So body of the mandible, angle of the mandible, and ramus of the mandible. If you talk about like ramus of the mandible on the outside, body of the mandible on the outside, you can see a foramen. You know very well, any perforation in the bone now is called foramen. The foramen, or hole, but we should not call hole, okay? Foramen. The foramen present here, okay, is called a mental foramen. Mental foramen, M-E-N-T-A-L. You know very well, the inferior dental nerve on its way course inside the mandibular canal, it comes out outside the body of the mandible through this mental foramen, giving rise to mental nerve. And where is the location of this mental foramen? You can see this mental foramen in between the root tips of two mandibular premolars. So if you assume here is the root tip, here is the roots of two premolars, you can see in between the root tips of the mandibular premolars. That's about mental nerve significance. Is that clear? And if you go to like the ramus of the mandible, you can see few parts here. You can see the one which is at the front or anterior is called coronoid process. Coronoid, C-O-R-O-N-O-I-D. Coronoid process. And the one that is forming the joint is called condylar process. C-O-N-D-Y-L-A-R. Condylar process. You can see a notch in between this coronoid process and condylar process. Okay, this notch is called what? The sigmoid notch. Sigmoid notch. That is what we can see on the outer surface of the mandible. If you see on the inner surface of the mandible, well, obviously you can see the same parts anyway. The body of the mandible, the angle of the mandible, ramus of the mandible. On the inner surface of the ramus of the mandible, you can see a foramen on the inner surface. Okay, foramen called mandibular foramen. Mandibular foramen through which the mandibular nerve branches always go inside. Say the mandibular nerve branches you know very well: long buccal nerve, inferior dental nerve, and lingual nerve. The inferior dental nerve branch of mandibular nerve goes into the mandible through this mandibular foramen, what you can see there. Is that clear? Just next to this mandibular foramen, you can see a tiny bony spicule. It is called lingua. Any doubts so far? Any doubts? That's about the parts of the mandible. You can see body of the mandible, angle of the mandible, ramus of the mandible. On the outside of the body of the mandible, you can see mental foramen in between the two root tips of or root apices of the mandibular premolars. On the ramus, you can see the condylar head, the coronoid process, and the sigmoid process. On the inner surface of the ramus of the mandible, you can see the mandibular foramen through which the inferior dental nerve enters into the mandible, traveling in the mandibular canal, supplying all the teeth on one side. And the protuberance or the bony spicule, the tiny bony spicule present just near the mandibular canal,